So the one video to summarize the last part of the year of themes that we discussed in Share Medical Appointments, individual appointments, and the postings is the gut issues. So the common theme is with the sympathetic system, the adrenaline, fight, flight, or freeze is the opposite is the parasympathetic or vagal is rest, digest, or vacation mode. So in a high sympathetic state, a basic premise is that you can't rest or digest. So commonly what we would see is that when people are in a high adrenaline sympathetic state, that their GI system often starts to have dysfunction or malfunction. After the typical orthostatic symptoms of standing up, feeling dizzy, lightheaded, woozy, fatigue, racing heart rate, chest pain, the next organ system to go sideways or array is the gut, which is anywhere from the mouth, the throat, the esophagus, the stomach, the intestines, to have issues. So you can't rest or digest in a high adrenaline state. So symptoms we would see are bloating, irritable bowel, diarrhea, constipation, fluctuating, those issues. So one of the things we'll find as soon as we get people diagnosed and getting them to feel better, reducing that adrenaline state, that people start noticing they can digest better, a lot less pain, a lot better digestion issues. That aspect improves. Also is much of your immune system is in your gut. So food intolerances, food allergies, that some of that mast cell activation occurs in people in these new gut problems that develop in face of POTS. So you'll see high adrenaline states leading to suddenly have food intolerance, food allergies, and often again getting the adrenaline down will stop stimulating this immune activation, and also getting the gut be less immune triggered, and people can start eating better. Often just getting people slowly to some people we can just really get them to introduce small amounts of food for them, reintroducing foods back to get them restored to their normal nutrition. That doesn't work for everybody. So I want to apologize. I don't want to make it seem that easy for everybody, but it can work for many people. A common symptom also we see is swallowing issues. Swallowing is vagal. And so with high adrenaline states, people often have this catch, gagging, difficulty swallowing, raspiness to their voice, so they catch. So a lot of the muscles get tight here. We'll work with speech swallowing therapists to help people get over their hurdles. So people initially will notice sometimes swallowing pills, water, food, just feeling this very, again, catch, strangled, feeling very interior of the neck, this area in a high adrenaline state. So different modalities from speech therapy, physical therapy, massage. We've had people work with ENT, sometimes even Botox injections here to the outer muscles, muscle relaxants. But again, identifying this does happen in a high adrenaline state can be very scary, and often people maybe going down the wrong diagnosis, especially with the internet. So again, the high adrenaline state causes many issues. In addition, high adrenaline causes dry mouth. So high dry mouth you experience. So the gut is a big deal that can happen with people with this impaired rest and digest state. And this awareness and doing things in this regards can help people do better to recover. We can also see people in a more sustained impaired rest and digest, often impaired nutrients absorption. We'll see low vitamin D levels, B12 levels, zinc, sometimes copper levels, magnesium, because they're not absorbing nutrients in their sluggish guts. We'll check that in our patients at times, depending on the scenario, and that can affect people's skin quality. You can see acne develop, and the hair quality be all thinning of the hair, dry hair. Some of our patients as manifestations of sometimes the micronutrients not being absorbed. So there's some of the skin and hair manifestations of POTS due to the altered gut functioning we can see. Again, this is a big playing field, the gut, how it can start to misbehave malfunction in face of the adrenaline state. Again, this is a simple introduction, really, to talk about gut function, and that awareness, knowing this happens, is so paramount to help you along, and just more tools of awareness and things that you can do. And many of these videos, there's 55 videos on this channel, many of them are educational, can help you. And awareness and education does give people validation and understanding to do better. Please subscribe to this channel, Wilson Orthostatic Exercise, because more videos get posted, and we really do these videos because we want to help you be understood and validated, and education will help you do better. Thank you for listening.